So all of the nerves that innervate, for example, for their bladder, for their rectum, for their GI tract, for their heart, their liver, their kidneys, their spleen, all come from here. Okay, isn't that like incredible? A lot of his problems were in the neck, but a lot of them were also here. And I think you knew that too. You could feel the spasms. Could you feel the spasms?
I couldn't feel the spasms, but you know, when they gave me the x-rays, they said all of the ones that were bad, it seemed like they were.
So the ones that, so when they x-ray and they say they're bad, so they're fused, right? It's probably pretty common in this breed. That means even more we need to open up the space. It's not that you're gonna decalcify it, it's calcified in, right? It's called ventral bridging spondylosis. But what you're gonna do is you're gonna open up the space just a little bit so that the nerves can communicate better. And actually for him, this is like amazing. Oh good. I mean, look at this. He doesn't have any fasciculations, twitching side to side. So I'm probably gonna just look, now I'm looking side to side, so I'm looking for lateral motion. And now I'm gonna go ahead and look for dorsal ventral motion. Does that make sense?
Yes.
So how well does his spine move dorsal ventrally versus, which pretty good for him. If I find something, so these guys kind of have atypical spines anyway. You knew that though.
You're like, you paid for this?
No, I didn't say it. Okay, so I'm just gonna do a quick little subluxation. Fixing here, right along. This is T13, L1, L2, right along those areas there. And there's a little bit of something going on here, so we'll just go ahead and, it's left, so he had a left lateral subluxation at T13, L1, and then he had a dorsal subluxation right here too. So if we just show it on the spine, it might look something like, so right here at T13, L1, it might look something like what I felt. Well, don't jump off, that would be bad. It might feel like that for a lateral subluxation, and then it might feel like that for a dorsal subluxation. So you've got, it's called a posterior at T13, L1. So good. And then I'm going to check his pelvis for alignment. We're going to check right along these are called tubersacrales, suprasacral bones. Top of the, you could tell it's the top of the, a lot of people confuse it for the hips, but the hips are actually here. So that's the hip joint. That's where the bone feeds in. He's being really good about all this. This is a little different than usual. So I'm going to check for alignment, making sure that these two bones are even here. And also I'm going to check for making sure that the sacrum is even here. Yeah, there's just a tiny bit out here. It's a tiny bit tilted over to the left, so I'm just going to go ahead and adjust that real quick. And then at the same time, I'll just check hip flexibility and range of motion. Really important as the dogs get older that they're able to move their hips and their pelvis normally. Okay, all that's really good. So I just did a few minor adjustments, but I mean, really for him, he's doing really great. And we'll go ahead and do a little acupuncture on it. I mean, I just can't get my mind around that sometimes. So that's why we like to focus on this upper cervical right here, making sure that this is moving as well as it can, even, so the nerves can do their job. Otherwise, because the whole thing about chiropractic is if there is a bone that's not placed correctly, then the nerves have trouble getting through. It's like there's not enough room. I don't know if you can see it in his face.
Shoulder.
Yeah, well, it's the cervical. It's the lower cervical right there in the right side. So, can you see that in his face?
I can't see it.
Let's just make that a little bit more straight. Okay, not so jammed up. How old is JoJo?
We think between 10 and 12, somewhere in there.
We're hoping 10.
10 and 12, so he's getting a little bit older. But he's still a baby. Okay, I got this one. See, he totally knows. It's like, whoa, she found the spot. And I think he might have a rib out there too.
No, okay, don't have to. So funny with the animals too, because it's like I just sit there and end up talking to them.
Good to talk to.
So
They
far, I haven't
listen.
heard any. Yeah, I haven't heard
They
any little
listen.
voices back.
That's okay, they're just listening.
But maybe one day. Yeah, they listen. So you guys, do you have any questions about his spine, or were you saying that he was limping a little bit, or he wasn't walking?
I could just tell from his gait that he wasn't comfortable.
Yeah, but he's not limping on a leg exactly.
He's
It's
not,
just
yeah,
more.
he's not like lifting a leg like a leg is hurt, and he doesn't have a clear thing like he's trying to stay off a leg.
Okay, let's let him shake that out. Jojo, you want to shake that out? Shake it out. Jojo, shake it out. So but the real, kind of the biggest reason he's here is because of his skin.
Yeah.
Yeah.
Let's, can we shake it out? I'm gonna shake it out. Has he been shaking his spine normally? Like at home if he gets wet?
Yeah, he will.
No.
Yeah,
Okay,
so
he will. Maybe
It
he's
is
just
a
being-
natural thing for him.
Okay, but has he been doing it normally lately?
Not, I haven't noticed it.
Because you want him to, you want him to be, like if he gets wet, you want him, that shake that they
Yeah.
do?
Yeah,
Usually they'll do it when I'm done with chiropractic too, but not if they feel uncomfortable anywhere.
Okay.
So they should shake their full spine, their whole spine, shake it all the way down into the tail, and that should be what they do. So when they get older, sometimes they get a little arthritic, or they have a little area that's sore, and then they won't shake. But it's a measure of spine health when they shake like that. So I want to give a little more information about veterinary chiropractic here, because most people think that you can't, you don't need chiropractic unless your dog's unable to get up or your cat is hobbling around. And I just want people to know that in younger animals, one of the first signs of chiropractic problems is actually a proprioceptive deficit. It's almost sometimes imperceivable. The cat that can't jump up as high as he used to be able to, or the dog that has trouble turning from side to side, his neck, or he trips a lot, he acts clumsy. And people don't realize, that could be a symptom of chiropractic or a spinal problem that's just starting. So getting in there early is really great if you can. Most of the time the radiographs are normal, and the even though there's spinal malalignments, the body will heal itself the best it can and compensate and often will transfer problems to a different part of the spine. So it's important to realize it's kind of nice to nip that in the bud and not to have the body do all that work. But that's sometimes difficult to find someone in your area. Then I just want to have an acknowledgement to my early training, which was in the 90s. I actually trained with Sharon Willoughby, who was the founder of AVCA, the American Veterinary Chiropractic Association. She was both a chiropractor and a veterinarian, and really kind of suffered from both sides. These two fields, veterinary medicine and chiropractic, they still, in my opinion, really don't understand each other very well. And it's unfortunate on every level. But she got licenses yanked. She was up against boards. People did not like it that she was more or less, in cahoots with the other side, So it doesn't have to be this way, especially these days. We can just build bridges between these different fields. And that's what I want to do here. And a lot of people are doing, which is great. Veterinary medicine tends to be very skeptical of chiropractic. I say doesn't really understand why someone would need chiropractic, which is unfortunate. And chiropractors tend to be skeptical of veterinary medicine, sometimes thinking they can heal everything just with chiropractic. So neither one is all the way right, neither one is all the way wrong. It's really a matter of balance and understanding when there is, but yet I feel like if anything, the veterinarians really need to learn what chiropractic can offer. So the APCA is who I got certified with. Then I went and spent time with Dr. Sherry Gaber, who taught NUCCA and still does it in California, and she basically can heal the whole spine through just adjusting the upper cervical. Her dad was one of the founders of the NUCCA school. And then I wanted to acknowledge Pedro Rivera and his wife that have the Healing Oasis in Wisconsin. They're doing a lot of good work training a lot of veterinarians to do veterinary chiropractic and other modalities, which is really great. Most of the time, most people seek out veterinary chiropractic is when their older dog is stiff, limping, has a rear limb dragging, maybe dragging one side, the cat that's stiff or limping, and for horses, pain when saddling or girthing, an uneven gait, and then tripping or clumsy behavior. I mentioned that before with proprioceptive problems, but that can be very, very important here. So it's something that will often immediately get better. The dog that can't bend its head from side to side, or one side won't bend, and then do a little gentle chiropractic, and that often will get better. So it's kind of a satisfying profession to be in. For veterinarians, you do not have to give them medication. You can actually heal with your hands, which I think healing with your hands for a doctor is probably as good as it gets. So, and then this is a little dog named Quayla, who I'm going to talk about in the next set. So thank you so much.
So, and it's a little bit off now, but it's not bad like it was. So the deal was with this dog is that she was in the show ring and she wasn't holding her head up. And they didn't like that in the show ring, right?
Her natural head carriage is up.
Yeah.
But she had a little bit, the Ridgebacks play a little bit hard.
Yeah.
So,
So then she had an injury to her atlas, and what happened was it was crooked, basically. And she had her head,
she was carrying it
lower.
below the horizon.
And she's young.
She's
9
14,
months?
no,
14.
right now she's 14 months.
Okay.
But at the time, I think she was like 9 or 10 months.
Yeah, so what I want people to know is just some gentle chiropractic once for a young dog like this is all they need. They don't need to keep having chiropractic. So let me just show people. Okay, see, and so I'm just gonna check her rest of her, and so she knows she's a good girl. She's such a beautiful dog. So has she been doing better in the show ring?
She's a champion. She's
She's a champion at 14 months.
she's a champion at just under a year.
That's crazy.
Oh, it's a long story. Anyway, she's a special now, and we just take her out selectively because she's so young. I don't want to burn her out.
Cool.
So she has a long career ahead of her.
Cool. Well, what I'm doing is I'm checking the atlas from side to side, front and back. I'm seeing how much space is there between the occiput and the atlas on each side. And like before, it was jammed up on one side. Yeah, it was. And now it's not. It's really, really even. And then you also want to check and see if it's rotated downward. The position of the atlas in relation to the occiput tells you how many nerves are being pinched on one side. So if the nerves are pinched, they're going to hold their heads totally differently. It makes sense, right? See, and she's like, I'm not even sick. I don't know what you're doing. Okay, I'm going to check her, if she'll let me, I'm going to check her sacrum. Yeah. Okay, so her sacrum's a little bit off. Let's see. And I know she plays real hard.
She plays real hard.
Wait.
Stay.
She's a good dog, otherwise I wouldn't be back here by myself with no holding. Okay, perfect. So what we have is some left-sided subluxation through the LS region, right through here on the left side. Right side, probably a little bit on the right too. So when I do chiropractic, you can't even barely see it, unless you know what you're looking for, and that's the kind I like to do.
Magic fingers.
So if they have parts of their nerves not functioning well in the sacrum, that's going to affect their whole nervous system.
Mm-hmm.
And then we also want to make sure that the pelvis is aligned, which see how perfect that is aligned now. So now I'm going to go one side or the other. How you can tell if your dog has some chiropractic subluxations is that their spine will wiggle when you just touch one side, wiggle, 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 but the other side it won't wiggle.
Oh, really?
So there'll be an asymmetric response to tactile response. So, let's just do one more here. Yeah.
Oh, she's.
Well, no, that one she felt. That one was stronger. I know, you did good though. Once you Quayle, you were a good girl. Let's see, that's it, I think. Let me bring her over this way. I mean, I just can't, I'm so happy how her Atlas held. You are so smart. You have such a strong bite force.